People are at the heart of everything we do at Combined.
So of course we wanted to create a platform to showcase everything that we do to attract, retain, support and recognise them.
Welcome to the People Show. Welcome to the People Show. I'm Martin Evans, I'm a non-exec director and I chair the People, Culture and Development Committee, which we lovingly know as the PCDC. And I'm delighted to say I'm joined by Frieza, our Chief People Officer. So Frieza, welcome to our first People Show event. For those who haven't met you yet in the Trust, tell us a bit about yourself.
Well, I've only been in the Trust for a short time now, as you know, Martin. I just started in June, but I previously have worked in the NHS for quite a long time. I've worked in the NHS for just over 20 years now. I started my career on the National Management Training Scheme, and I've worked in a variety of different types of NHS organisations. I have experience of mental health, working in provider organisations, but also of commissioning. And I'm really sort of passionate, a public servant, really, inspired by the work that our staff do within the NHS. So that's, what brings me to Combined, because it's recognised as being a really outstanding organisation. So I hope I'll be able to make a contribution here. Brilliant.
Well, having interviewed you for the role, I know that you've got a wealth of experience that you bring. You've touched on some of that. What else have you been involved in that you really think can add value to the work that you bring and lead within Combined?
Well, I'm particularly passionate about development, so I've been focusing on that, with whatever time I have available outside of my normal role. I take the lead for a lot of the development work that happens for people professionals within our region. I'm the Vice President of an organisation called the Healthcare People Management Association, which is our own professional body equivalent for healthcare specific sector. So I design and think strategically about the programmes of development, the support offering that's required, and member organisations, of which we are one, are able to access those programmes. So it's for the wider benefit of the NHS, and it's accessible, for people working in managerial and leadership roles as well. So that's something I'm particularly passionate about, and that passion for sort of development extends into education as well. I carry out a non-executive director role for one of the largest academy trusts in the country, which is so rewarding, and it helps me to be able to see the future potential workforce that we absolutely have an imperative to try and attract to come and work for us and remain vital as a key anchor institution within our local health population. I've done various other sort of roles and responsibilities at regional and national level, taking the lead on projects such as equality and diversity initiatives and health and wellbeing campaigns, and I hope to be able to lend some of that support and experience to the wider work that we're doing on collaboration within our system.
Brilliant, thanks Frieza. I know there's more that you do, but you're not telling us, you haven't got time to tell us about everything that you're involved in, but hopefully that gives people a real good feel for some of the skills and expertise that you bring to the organisation. We're delighted to have you here as our Chief People Officer. You touched on one of the reasons why you were keen to come and join Combined is because we are an outstanding trust, and we're all very, very proud of the fact that we are rated as outstanding. What else attracted you to Combined?
I think it was specifically that you weren't just outstanding in the quality of patient care, but there was a real intense focus on the role that people play within that. And you can see that as evidenced by the staff survey results, which consistently for many years we've achieved top quartile staff satisfaction, and we've never been an organisation, from my perspective, looking on from the outside in and now here, that's been complacent about that. We've always wanted to continue to improve and see what we can do to create a culture here that's very specific to creating that sense of belonging that all organisations are trying to do, to get that connectivity between people, so that we have more of a chance of being able to retain our really valuable talent and continue to make a difference for our local population, our communities, and of course our patients.
Okay, and I can sort of relate to an awful lot of what you've said there. I've been here for 12 months now, and some of what you've just talked through is exactly why it was that I wanted to come and be part and parcel of Combined and help to continue to improve the organisation moving forwards. So you've been here a few months now. What's your first impressions of the Trust?
Well, I have to say, I mentioned earlier that I've worked in the NHS for 20 years, and so I have some level of familiarity, but I've never received such a warm welcome of anywhere that I've worked before. It very much feels like a family environment. I know people often refer to the Trust as the combined family, and I very much have received that. I think what's really exciting is that anytime there's an idea or a thought about an improvement that could be made or something that we would need to look at, focus on, that immediately the instinct is to look at that in terms of the art of the possible. From an innovation and improvement lens, there isn't any reticence or anything. The first kind of view that people have is, okay, let's try and understand that. You don't even hear from people, well, that's something that would require a lot of investment, or we'd have to really think it through. So I think for me, that's just a sign of a really great positive culture that helps to continue to drive sustained performance and improvement. So I've really loved that. I've loved getting out to meet people and understand more about the jobs that they do and understand about their passions, and what keeps them here, what attracts them. And I don't think I've ever worked anywhere where people have such longevity. I think you and I are like the new kids on the block, but generally people, if you ask them, have been here 20 years, 30 years, that's the minimum sort of time period. So there must be something about the Trust that's really, amazing, that keeps people here, keeps people invested.
You're right. And as you say that, I'm just thinking back to a few months ago, we had the long service awards that I came to, and I was blown away by the amount of time and commitment that people have given to this organisation. We got individuals there, 30, 40, I think even 45 years service, which was absolutely phenomenal.
Yeah.
So absolutely right. So NHS, challenging time. It's a really challenging time at the moment. We've just got a new 10-year plan out. We've got our own people plan within Combined. We're probably about halfway through our 5-year people plan, so it's timely to be looking to do a refresh of the people plan in light of things that have changed within the organisation, within the communities, within the system, and nationally within the NHS. So just thoughts from you as to how we're going to go about refreshing our people plan now. Really important that we've got a real focus on where we're going with people moving forwards.
I'm really glad you've asked that question, because that's certainly something that's been a big focus of our attention, and my team are actively working on that now as we speak. We're looking at how we've delivered against our existing commitments, where we've gotten to with, I have to say, the really ambitious people plan that we had, that was very developmental focused and for all the right reasons, and we've done work that we can really, really be proud of. But as you've rightly just touched on, we are working in an ever-changing, kind of shifting landscape where we're subject to a high degree of pressure, not just to remain financially sustainable, but to work collaboratively across traditional organisational boundaries and to take on more responsibilities. So it is really important that we really look back at everything that we do and ensure that our precious resources that we have that are utilised as effectively as they can be. And that really, if I'm honest, realistically involves us focusing on a smaller number of things and absolutely committing to doing those incredibly well, as we have been already. But I do wish to ensure that we're set up for success moving forwards and we're able to remain fit for the future. So in view of that, we'll be looking at what other things that are really important for us to be focusing on, because they meet that requirement to remain vital as an organisation. So there will be things in there that are focused on effectiveness and efficiency measures. There'll also be elements in there that are focused on supporting the organisation to respond to the need to adapt and to meet the transformation agenda in terms of clinical pathway, redevelopment, redesign, and some of the work that we talked about earlier in relation to provider collaborative, which I know you're quite familiar with as well. These are things that are sort of taking off and at pace, and we need to organise ourselves well to be able to respond to those. There's opportunities in there, and of course there'll be some challenges for us also. But that doesn't mean that we take our focus off the developmental agenda. In order to remain outstanding, we absolutely need to continue to deliver a high-performing culture in which we support and enable our staff to feel like they absolutely are valued and belong in our organisation. So there will be things that we'll do there to help ensure consistency of their experience, because we're also committed, as you know, to responding to staff survey feedback. Yeah. And there are key areas that we need to work on in that space to ensure that we've got consistency and fairness, and that we're managing things effectively at the lowest level possible, empowering people to be able to resolve issues without them escalating unnecessarily, and continue to create a really positive organisational climate. So there'll be things on inclusion and health and wellbeing that we'll continue to prioritise and focus moving forward.
Great, and that's areas that we talk through in detail in PCDC, isn't it? It's really important that we've got to focus on our people. It's our people that ultimately are there delivering the fantastic service day in, day out. It's that service that, as you've sort of talked through, is going to be forever developing moving forward. Some of that far more integration with other partners and communities moving forward. So we've got to make sure, we've got a responsibility, haven't we, to make sure that we are looking after our staff, we're giving them the development and the support that they need to forever develop the service that ultimately they're delivering Absolutely. Day in, day out for us.
Absolutely.
Great. So if you were to look back in 12 months' time, accepting that we're looking to refresh the people plan, but from a people perspective in 12 months' time, what are some of the things that you will hope that you'll have been able to have influenced as our Chief People Officer?
I absolutely want to create an environment in which everybody has an active voice to play in the running of the organisation. So one of the things that I'm really focused on is employee participation, and looking at all the routes and the avenues that are available to us to be able to actively engage in how do we shape and grow and influence and outside of the organisation, but also internally, the way in which we run our services. So I think that it can be something that at times, can be a little bit nerve-wracking for people. I've noticed that in meetings that if people are very, very kind and respectful and very courteous of one another, but I think it's really important to have very robust debate about the important things that we will need to respond to in the future. And sometimes as leaders, we really need to be able to test some of our planning and assumptions. So that's something that I actively want to work on. We already have an inclusion council, which I'm looking to extend to look at it more from the perspective of a staff council governance mechanism that operates as a shadow board for the organisation. So the only contact, with NEDS will not just be through formal things like recruitment processes or attendance at the board. It will be very much, a check and challenge process with our own staff who are helping to co-produce some of the change that we needed to respond to around us, our plans. So I think that will increase the likelihood of people remaining invested in us and feeling actively part of the decisions that we're making, and it will maintain high levels of engagement for us. But if I have to be really honest, one of my biggest personal passion areas is widening access and participation. So I'm very much focused on reviewing our approach to that. I know we've had tremendous success in the past, but I'm looking to try and actively target some of those sections of the community that are not able to really maximise their potential life chances because their access to employment and to education opportunities is limited. So that's something that will also be a big focus, I think, moving forwards. It's absolutely important that we continue to play a vital role in that. We're a big employer locally, and we're very much relied upon by our community, not just to provide the services that we do for our patients, but also to be a stable force supporting the local economy. So that's an area that I want to develop in. And of course, I'm really passionate about inclusion and health and wellbeing, as I talked about earlier. But I want to really be specific about what it is that we're wanting to focus in on, and not try the same approach everywhere. There are really massively brilliant areas of good practice that I see in the organisation every day, day in, day out. We had a brilliant staff story at our People and Culture Development Committee yesterday, which you're the chair, Martin, and I know you'll be familiar with these staff stories. They're very inspiring for us, aren't
Unbelievable.
they? And this story was about one of our managers who started their early career with us, who developed into a managerial role, and about their personal passion for people in their area, and they made it their absolute business to do whatever they could to make their team feel as though they were really, there's a high levels of camaraderie, there's a high level of commitment, a high level of support, and they made it fun at work. You know, it wasn't just a job. People actually look forward to coming in and spending time with their colleagues. So I know we've got big programs of development work in Train that are looking at how do we look at team development in a more structured way, such as the affided program. But there's things that every day we can do, each one of us as leaders, as managers, as colleagues can do to improve the quality of the experience for each other and for ourselves. So that's one of the things that I'd like to be able to think that we can make some rapid progress on in the next 6 months.
Okay, sounds great. 6 months and not 12 months, so that's
Yeah.
even better than I'd have hoped. So we've got the people plan refresh. I know as PCDC we've got a focus session having a look at that at the end of the month, so that we can, you know, get a really good update from you as to where we feel we need to prioritise, so that we can also give our views. You know, just to share, as you know, I'm really passionate about, you know, making sure we embed even more than just a learning culture, doing some work, even more work around civility, wanting to make sure we're empowering our staff, we're really encouraging people to innovate, lots of innovation that takes place at the moment, but I think there's lots more that we could do moving forward. So we'll have a really good session in our PCDC focus session at the end of the month, so really looking forward to that. I suppose lastly then, just a couple of areas of performance from a people perspective that kind of perhaps aren't quite where they need to be at the moment. One is sickness levels, been quite stubbornly high for a few months now. We have a target of 4.95. We're on about 6.2%. That's higher than other NHS trusts locally and higher than our most similar trusts. Obviously, you know, concerning in that we don't want to hear about members of our staff not feeling well enough to come to work. Ultimately, it's impacting on their home life as well. It impacts on colleagues that are having to fill gaps, and ultimately it can impact on, you know, the service that we're able to provide to our patients and communities. So just some thoughts around the sickness piece that we need to do.
Yeah, absolutely. This is an important area of focus for us, and I think we can see that although all trusts, you know, nationally have seen an increase, our increase proportionately is higher, and we are an outlier within our local system. And I think that we have seen some small incremental progress, but it's not really keeping pace with the level of improvement we potentially need to see to give us that confidence that we are meeting our obligations to our staff and to our patients in an ongoing way. You can see some parallels between the levels of sickness and the increase in demand.
Yeah.
The staffing pressures that we've had in a lot of cases, but not necessarily in all cases. But some of the sickness issues that we've got, I think you've touched on them already, are related to you know, the level of expectation on staff and the nature of the environment staff are working in. So there are some more positive, proactive things that we can do in reaching into services to understand what might be those things that are impacting on health and wellbeing, which absolutely need to be clinically and managerially led with support from the people function. And we need to be taking that anticipatory approach. But having said that, there are other things that we need to be doing to demonstrate to people who are unwell, and particularly for those who are long-term unwell, that we actively are concerned about them, that we want to support them, because it is very isolating to be left in a situation where you feel as though you have been forgotten about. These are things that our staff are telling us about. We are leaving people, sadly, too long before we are engaging with them to try and understand what we can do to return them back to work. So these are the things that we would want to work very proactively to identify with managers what more we can do. We'll be doing some auditing of practice in the area to understand what those opportunities are for improvement. We've also done a very deep dive review of all of our performance in sickness over the last 12 months, and just putting together a report with some recommendations and some action planning for how we take that forward, and ensuring that we've got the accountability and the responsibility in the right places to help support driving that improvement. Why? Because it's absolutely the right thing to do for our staff, and it's the right thing to do for our patients, as you've mentioned earlier. But I think we can't forget that there are certain themes that are being identified. There's particular areas where prevalence is higher, and there's particular types of issues that are coming to the fore. So we must always keep one eye on what can we do to be more proactively addressing any of the underlying issues, alongside managing things on an individual kind of basis for those people that need that support.
Yeah, okay, thanks, Frieza. And last one from me is in relation to appraisals, staff appraisals. Now, I know actually it might well be that there's just a factual accuracy in relation to recording of the appraisals, but seems to be the amount of appraisals that have been done seem to be reducing slightly. I think we're on about 81, 82%, almost a fifth of our staff. What the stats are saying is haven't got a current appraisal. Again, it's an area of real passion for me, really important that staff are able to have one-to-one conversations with the line managers to make sure that everything's okay at work, they're clear as to what their priorities are moving forward, they've got all the support and development they need. Just a quick bit of assurance in relation to the work we're doing around appraisals.
Yeah, absolutely. And I think we're both, we've identified that we're really passionate about development. And as you've already alluded to, this is one of the few times in a year when you can have an unapologetically selfish conversation with your manager about what your aspirations are for yourself, for your own personal, professional growth, and where you see your career heading. So I think it's really, really important that we have noticed that there are a few issues with some of our reporting and recording, which we're looking at the introduction of a new system that will help to address that. But even so, appraisal performance has dipped compared to where we would normally be at this time of the year. We'd normally be at least 85%, kind of pushing up to 88 and 90% in the next few weeks. And although we have received assurance from our managers and colleagues that they actively are working on that, and we provided assurance, myself and my own team, that we'll address the systems issues. What I continue to be concerned about is that quality of the conversation, how meaningful that engagement is. I think you just touched on that, didn't you? And that's something that's come up in our staff survey. If we're not having a conversation that actually helps to restore our staff's confidence in our commitment to them, or maintain their confidence, I imagine there is already confidence there already, that we were, committed to them, because we've got a lot of longevity in the people that work for us, but we can't be complacent. There are a lot of jobs out there, there's a lot of organisations out there, and people are constantly moving, between organisations. So there was some research that was done by Health Education England a few years ago that said that any one time there was 400 nurses that were moving just between trusts within the Midlands alone. I'm doing exactly the same job, literally just down the road. So I think it's really important for us to make sure that that conversation is a meaningful, quality conversation, and we remain committed to having it on a regular basis.
Absolutely. Frieza, let's pause there. Thanks ever so much for your time today. Look forward to continuing the conversations in future People shows.
As do I.
Thanks very much.